Sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.
Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, for every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, and fascinating health topics, of course, where we do always encourage you to call in to join in. Today, well, we've been all over the board this month. We've brought some fascinating guests for you. I hope you really did enjoy our encounter with Konstantin Monastersky. I think he opened a new can of worms that's going to require bringing him back when talking about his treatment, literally his treatment, which was his own treatment for diabetes, which he now no longer has. Hope you got those points pointed out to you. And the first time we have an open phone day, I'll reiterate them because I think they're fantastic. And as long as I've been in this medical game, I've never heard them before, and they made such sense. So you can go back to the show on Monday and listen to that, or you can stay tuned here, and I'll bring it up in the near future. Today, we're going to be spending some time with a very good friend of mine. Mentor to me, and I think a guiding light to most everybody in the Western Pennsylvania area as far as alternatives to conventional treatment go. I call him the godfather of alternatives in the Western Pennsylvania area. Of course, I'm referring to Dr. Roy Kerry, who certainly in his career as an ENT has confronted this issue of allergy over and over and over again, but now comes across a brand new, spanking, different way to treat them. And he ought to know because he's been treating them for his entire career. We're going to be learning the process of learning and treating with LDA. I'll spare trying to tell you what LDA stands for. You stay tuned today, and you'll certainly find out. We're going to do part one today and just get this subject underway, but to make great sense of it. And then we're going to continue and finish up with the next part next month. By the way, just to let you know, that'll be on the 5th. So part one today, LDA. This is an allergy treatment you just got to know about. From the guy who ought to know about them, Dr. Roy Kerry will be with him right after our first break. Now, in the course of our discussion with Dr. Kerry, if you want to call in to ask a question or to make a comment, that number, of course, will be 412-825-6262. That's 412-825-6262. And I will give that number additionally throughout the hour. Now, the schedule as it's shaped up right now will be, Roy, of course, is going to be here today. On Friday, David Brownstein returns. We're going to talk about conventional treatments that don't work and a whole host of alternative treatments that do. One of his many books, David with us on Friday. Then the following Monday, next Monday, Roy's going to be back talking about part 2 of LDA. And as I say, you'll find out what the LDA means here today. And it is just a fascinating treatment regime, relatively new, but of course Roy wouldn't know about it, and he'll be teaching not only you all, but me in a training session I'll have with him in the up-and-coming months. On Wednesday, she, talking about Dr. Vava Vavoom herself, Dr. Susan Smith-Jones, will be back talking about ways with the holiday season in mind to avoid, and if unfortunately you can't, to correct an issue of hangovers. I know that it's so rare that you do imbibe throughout the year, but this, of course, is that time of the year when even the most teetotaler of all sometimes partakes of a little too much. Anyway, that'll be on Wednesday the 7th, and then the other days of the month will be shaping up. Additional items to mention to you, of course, MCG testing now in full swing. Now that we have the device, we've procured it. It is in the house. It's in the office. And when we have it here, we absolutely will be able to do frequent testings to all of my regular patients. But for those of you out there who are listening and aren't really patients of mine, or at least not yet, you may want to partake in this MCG testing. It is an insurance-covered item. It's a way to find out about the status of your coronary arteries in a completely non-invasive, non-threatening way, the information of which parallels almost to a T, 91% accurate when compared to a cardiac catheterization, which no one wants you to ever have, including yourself. Anyway, in the month of December, here are the dates. If you're interested in seeing us in our Monroeville office, then you're going to be on the 6th and the 20th of December. And here in the McMurray office on the 8th of December, give us a call, 724-942-3002, so we can get you scheduled on those dates in a geographically pleasing way, MCG testing. And then, of course, we'll schedule a time when we get to do the test to go over those results, which is the real beauty of this work, to find out what the status of the coronaries are, and if there's any sign of coronary artery plaque, and to the degree that you might present it, coming up with a treatment plan to actually correct it, so it need not ever get out of control, out of hand, and lead to, well, some pretty serious consequences. So that's the status for MCG testing in the month of December. I'll keep on repeating it as the clock and time rolls on. Should mention, oh yeah, got a couple of calls, by the way, on the air from you asking me about, is Dr. Condrot coming back to do one of his treatment seminars? And I believe I said, look, why don't you give a call out to his Phoenix office and express your desire to want to be treated here in Western Pennsylvania. He had originally intended to come out in the month of January, and I wasn't really sure if, in fact, that would ever take place. Well, when it comes to Dr. Condrot, you really have to guess that so much new comes up. Now, get a load of this. Got an email from him the other day. He is now in Rome, Italy. He has sold or is selling and will be selling his Phoenix practice. He's going to be at the University of Rome doing studies on his microcurrent stimulation, which he uses as one of the main components of his treatment protocols when it comes to eye disorders that can't really be corrected with conventional therapies. Microcurrent therapy is a big part of it. Anyway, he's at the University of Rome with his lovely wife, Lee, and they just picked up roots and moved to Rome, now to return only to do these treatment seminars. And, of course, here's the punchline. He'll be doing one here in Pittsburgh in March. And the dates will be the 23rd, 24th, and 25th. There, of course, will be a free lecture and seminar on the 22nd, a Thursday. A little different. We've normally held these on Sunday, Monday, Tuesday, and Wednesday. This is going to be a Thursday, Friday, Saturday, Sunday combination. Anyway, if you had called to initiate this, which maybe has led to why he's going to return in March, or now if you're hearing that he is returning and you think you'd like to be interested and be a participant in this, the number to call is his office, but still somebody answers. I think actually the office is closed yet. This happened too quickly. But the number is 623-516-0010 to get you scheduled in the treatment seminar, the eye treatment seminar, which you hear so much about here on the radio show whenever he comes to town. We normally give him a whole bunch of support, and this will be done in my office once again on those dates. March 22nd for the free lecture and seminar, then the treatment seminar itself, 23rd, 24th, 25th. If you do have an eye condition, essentially the big three, macular degeneration, glaucoma, cataracts, these big three have a whole host of responses that are possible through alternative measures that really don't have a good resolution at all when it comes to the conventional medical model. So I'll keep on mentioning it. First time I threw him to you today, I said, what about that? Last time I talked to him, he was in Phoenix. Next time, he's in Rome. And he's on staff at the University of Rome. I'll let him tell the story beyond that, because quite honestly, I really don't know how that all came about. Okay, let's do this. I'm going to take a short break. I'm going to go look for my good friend, Dr. Roy, a mentor to me. I've got to tell you, folks, the godfather of alternative medicine in Western Pennsylvania. Now with a new treatment. We're talking about old treatments and the newest of treatments. Everything you need to know about allergies but didn't even know what to ask. Well, I'm going to ask it for you. You're going to want to stay tuned. We'll be back in a moment with Dr. Roy.
This is Dennis J. Courtney, MD. You become confused about how best to manage your health. It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Have you been to the doctor lately? Was fatigue top of your complaint list? Even if your doctor asks you what you eat, the recommended 5 servings of fruits and vegetables a day is a dream in your busy schedule. What if you learned of a product 5 years in the formulation that delivers 5 servings of fruits and minerals in just 1 ounce? That's right, it's Fruit of the Spirit. The blessings of Fruit of the Spirit are now formulated into a delicious whole fruit puree product rich in antioxidants and minerals. Your health is more than just a test result. It's a balance of physical, spiritual, and emotional factors. You work regularly to strengthen your faith. Let Fruit of the Spirit help cover your nutritional needs in a convenient and cost-effective ounce a day. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. Fruit of the Spirit, 5 servings of fruits and minerals with no added sugars. That's 1-800-442-3793 for your good health. Call them now, 1-800-442-3793.
Good morning, ladies and gentlemen. Welcome back once again, excuse me, to AM Impact on Your Health, heard here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on a Wednesday version of the show, and really a welcoming back of a colleague of mine that I've known for a number of years. You all have known him too. Yes, he is the godfather of the alternatives here in Western Pennsylvania, a mentor to me and to many other doctors throughout the country, a doctor by specialty of ENT, that's ear, nose, and throat. By virtue of it, has been exposed to allergies through his entire professional career. We're going to be talking about all things allergy today and in part 2 on next Monday. But we're going to introduce him now and bring him back to you. You know him very well, Dr. Roy. Thanks for coming aboard today.
Good morning, everybody.
You know, Dr. Roy, it's interesting. Last month when I was out there at the Freedom of Choice in Cancer Therapy group, I arrived late because of some crazy traffic, but I felt very comfortable when I walked into the room, and lo and behold, there was Dr. Roy pinch hitting for me until my arrival. And when I saw it, I knew they were all in good hands, Dr. Roy. So I wasn't surprised to see you. I was happy to see you. And everybody in the audience, actually happy to listen to you talk a bit about what we're going to be talking about in the next 2 shows, today and Monday, when we're talking about the treatment of allergy. But I'd like to spend a little bit of time going back in your career because it does set the proper stage for the discussion we're going to have. As an ENT doctor by profession, and just enlighten us a little bit about your career. I'm sure when you first started, it was completely conventional, but things happened and you moved away from conventional therapies early on in your career. Could you talk a bit about your pathway to the point where you begin and where you are right now?
Yes, I trained at Pitt and Ioneer, and we learned a lot about surgery in the ear, nose, and throat field, but I started practice in '69 And within a year, I recognized that you have to treat allergies to take care of the ear, nose, and throat. So I asked my friend, Dr. Fjord in Grove City, how you do that. And he said, come on over and then take some courses, and you got to learn to do this. And ear, nose, and throat, we have a whole subspecialty of otolarynghic allergy. Hard to say that word, but it's AAOA group, and I took training for them, and I'm a fellow of the Academy of Otolarynghic Allergy, as well as certified in ear, nose, and throat. And then 1978, I went into the field of environmental medicine, where we look at the whole environment as a cause of ill health, and also certified in environmental medicine as well as ear, nose, and throat. So we went and did the routine type of thing with weekly injections that we make them very safe with the method of testing we use that dilutes out the serums when we do the testing, and then we put the formula together exactly in proportion with the amount of reaction on the skin testing. Now that takes 2 or 3 hours of testing up and down both arms to get the whole formulas of dust, molds, and pollens, and that is really fairly conventional, and most ear, nose, and throat doctors do a good job of it. It's quite safe. And the testing method is so accurate that we let our patients take the injections home. We can give them their own injections, which some doctors are afraid to do, but I can count on a half a hand the number of people who have had a reaction, and that's because they took somebody else's serum by accident. But we've been doing that ever since.
That is pretty much, is that the conventional treatment that I would expect to get if I went to any allergist around? Is that the similar thing you're talking about?
It's similar, but not quite the same. The advantage of the ear, nose, and throat groups testing is it's more specific and accurate in terms of the degree of concentration of the allergens in the serum that is given. The pediatricians and internal medicine allergist method is not quite so safe, so they have people come to the office and get the injection and wait a half hour, and it's kind of inconvenient to be traveling all over town or in the next town or wherever to get your injections. So my practice goes out for 100 miles and 150 miles, and some people live in different states. That's very inconvenient to do it every week. It gets a little ridiculous. So we mail it to people every 10 weeks fresh, and they take their own shots, and makes it a lot more convenient.
Now, with the way that you began to treat allergy, which it sounds very conventional to me, I've known you for many years. I've followed you by how you sort of evolved yourself. In terms of the treatment of allergy, you became one of the initial people to sponsor the work of and then pursue the work in the energy realm, specifically with something called NAET, and then with something called biosets. Could you please tell our listeners what is meant by those two treatments? And they were ones that you really put the full force of your professional integrity behind, because you specialize in this to a degree that no one else has ever done in Western Pennsylvania.
Yeah, the NAET, I call it NEAT, spelled wrong. NAET means Dr. Nembederped's Allergy Elimination Technique. Dr. Nembederped in Los Angeles developed this technique kind of by accident. She was a brilliant nurse and enrolled in the UCLA med school for the fall, but she found that acupressure point therapy and a chiropractic technique helped her. So she went into those training fields, and her husband said, "You can't do that, because they're 4-year courses, aren't they?" And she said, "Oh, yeah, but they're one's nights and one's days. I can do it." So she did it, and she learned to do resuscitation with this technique. And she was violently allergic to everything herself, and only was able to eat white rice and broccoli for 3 years, would you believe?
Wow.
And then she was preparing carrots for her husband one night and peeling them, and took a couple bites, and an anaphylactic reaction reacted. She yelled for her husband to resuscitate her, and she laid on the couch, and he brought her back with these combination of chiropractic and acupressure points. And then the next day she tested herself with muscle testing, which she was getting fluent in, and found it was clear. And she said, "What did we do?" He said, "Well, you threw the carrots on the couch and you were laying on them." That's how she discovered the technique. So we learned about that.
So her allergy to carrots, she had an allergy to carrots, and she got relief accidentally by falling asleep on top of some carrots.
Yeah, well, she was laying on them when they did the treatment. So And she treated something else the next day, and we did it in that velocity technique. So I took that training course, and I said to her, you have to come to the East Coast to teach us how to do that. She said, oh, I can't travel. I can't sleep in hotels and so on, because she reacts to all the chemicals and fumes and mattresses and so on. And I learned that she had a wedding in New York City, that family she had to go to. I said, hey, I got you. You come to Pittsburgh, and it was a 2-day course. So I had her come, and we arranged the whole thing, and she just came and did the lectures for about 2 days. And I think we had 70-some people come and take the course here in downtown Pittsburgh. And that sort of lit the match in this area.
What year was that, Dr. Roy?
Pardon?
What year was that?
Oh, it's got to be 78, maybe 80, something like that. What's that, 25, 30 years ago, I guess. No?
And so at that time, you moved right into the end of the NEAT, N-E-E-T, and were using it as a primary tool, one of them, in your practice as an ENT treating allergies. When you found it, you moved maybe not completely away from the injections, but you pretty much went headstrong with the NAT approach, did you not?
Yes, because it works for foods, and the injections don't work well for food. Now, we do it, but it's very cumbersome. The endpoints change. You have to retest people. It usually takes injections twice a week, which is a nuisance for people. And so this stops the allergy with the treatment. Now, the inconvenient thing is it's usually one food at a time. And then we learned that Ellen Cutler, who I think took the training about the same time I did, and she put the computer with it and developed her BioSet system. We've kind of been using that variation of the NAT ever since. I've had 2 full-time technicians doing that, and I'm computer illiterate and trying to stay that way in the modern world, but these techs were faster and more adept than I am, and I just see people and feed the system, so to speak, and that takes 20 minutes to a half hour per food treatment, but it clears them. But it's not permanent, and sometimes it doesn't work for certain things, and doesn't work real good for the chemical irritation. And I have a large practice of people with chemical sensitivity. I mean, reacting to diesel fumes and kerosene and perfumes and hairsprays, virtually to the point of disability. Some people have this. And most doctors don't believe it's even real, let alone what to do about it. And the usual thing is tell people to avoid them. How do you avoid that in the real world? So we have been doing this for probably 20-some years and became certified in the field of environmental medicine, looking at the whole picture, whatever makes people sick.
Well, this is it's been a passion of yours. Obviously, out of professional necessity, people were coming to you with allergies. You've moved in from just the anatomical focus of ear, nose, and throat to whole body reactions with your environmental component. But I've been interested in the fact that you moved into an energy approach with NAET and the Butropod, as well as the Ellen Cutler BioSets, in a way that you put the full force of your professional integrity behind it. It served you very well. And the point we're going to make here, and we'll move to it, this morning in a little bit, would be, now where are you? And now you tell me when we meet each other in Butler that, hey, we've really got to look at this thing called LDA. It's what I'm using now, and whenever Roy Kerry speaks, I listen. In fact, quite a bit of the medical world listens to Roy when you speak. And we're going to be talking about that new approach, and I hope our listeners appreciate the build-up that we're going to be having to get there. Let's take another piece before we get to LDL, which is the discussion of the treatment of allergy in its most classical sense in the conventional medical community. The allergist approach. Some things came out in my conversation with you yesterday, which is fascinating to me in terms of what they use, how they do it, and the pitfalls of what they do. Could you sort of give us a primer of how allergy treatment works in the conventional community?
Well, mostly we give an injection to modify the immunoglobulins, and that's been known and used for probably 50 years, maybe getting longer than that. I'm getting old, and time flies when you're getting old. So it modifies the immunoglobulins to reduce the allergic load. It treats the immediate type reaction, but doesn't do a very good job on that delayed. Although with mold, we do the skin testing, and they don't react much, and we put them in anyhow because most molds are a delayed reaction. It takes about 48 hours to show the skin wheel. So we sometimes modify our injection concentration based on that. This newer technique works in a different way entirely. It's treating the T suppressor cells, which have about a 60-day half-life, and this modifies the complete immune response, and it even treats the type of things that are dangerous to life and limb with the anaphylactic type response. Now, we don't guarantee results for these things. We, in medicine, don't use four-letter words like cure and well in this field very much, but it's getting about a 70% response rate with the low-dose antigen with the anaphylactic type things like peanuts and shrimp and those sort of things also. It's helpful for that. It's a whole different mechanism.
I thought it was very interesting because I had never thought about it before until you mentioned it. And I think our listeners are going to find it fascinating that the allergists who we, I think, look to as the experts when there's an allergy, then maybe you would consider going to an allergist. And there's no one who's more adept in appreciating allergy than those who have the severe responses. You used the word life-threateners yesterday. If you have an allergy to peanuts or to shellfish, and you are exposed to them, you could literally die from an anaphylactic reaction. There are some people who are so sensitive. The thing that I never thought of before, and you just brushed over it a moment ago, I believe is a salient point, which is in the conventional world, if you have an allergy to peanuts or to the shellfish or to anything to that degree, it never does get treated. They don't treat it at all with serum. Could you spend a little bit about that? Because I think our listeners would be shocked to know that those who would need it the most, meaning allergy treatment, can get none in these life-threatening situations. I thought that was fascinating to learn.
Yes, they are told to carry an EpiPen and
yeah, here's a prescription for an EpiPen, and we'll see you.
Yeah, hope you see you.
Oh, hope to see you.
And get yourself to emergency room so they can do IV steroids and the whole 9 yards to keep you alive. But it's a scary thing to be out there in the world of peanuts, and even they don't allow them on airplanes anymore. Because what are you going to do when you're 30,000 feet up and someone has an asthma attack that won't quit? Just from the vapor of them being in the room. I had a surgeon friend that is at a party, and his wife was allergic to shellfish, and there was some in a dish of some sort, and she had an attack. And even though she was right in town, probably blocked from the hospital, she died of her asthma attack. Just as it was a surgeon's wife, a friend of mine.
Oh my goodness.
So that's how dangerous these things are. But you got to carry your EpiPen, and you know how to use it, and try to get to immediate medical help if you get into trouble.
Yeah, but I think it was amazing for you to reveal to me, because I never thought of it. Like if you have some sniffles, if you get some tear run, if you get mucous membranes that well up, oh yes, we can treat you as an allergist. Oh, but if you have one of those allergies? You mean like that peanut thing? Oh no, we can't help you there. We'll give you a prescription for an EpiPen and maybe a GPS to get to the closest hospital. That's about all they can do. That amazed me, Doc. I didn't know that. Thanks for enlightening me.
Well, they tell people that the problem is we don't know how to fix it, and therefore you have to use emergency measures only and try to keep yourself alive. We're even taught in our training courses on allergy, never test these things. Why you don't need to test them? Because people know what they react to.
They know exactly, sure, they know.
And they know what they react to, and so never test them, because the testing is very dangerous even.
Right, so you're not going to, somebody has a peanut allergy, you're not going to say, well, let me do this intradermal back of the forearm test.
Nope.
That could be enough to cause the reaction right there. So that's the no-no. That's what you never do.
Right.
Which is very, very interesting to me, and I think our listeners probably feel the same way. So, okay, there's Roy Kerry, the ENT doc, with the allergy component to his practice for all those years. Did it in an energy realm, did it in a serum realm, but now, Roy, you do things in a completely different realm, which really leads to the discussion, part one discussion today on LDA. Before discussing LDA, and now I'm a little learned on the subject, tell us what EPD was or is, because that's sort of the forerunner to LDA. Could you make sense of these letters for our listeners?
Yeah, the initial procedure was developed in Britain. It was called EPD. We abbreviate everything in medicine to make it easier to, instead of saying those long words. But it's enzyme potentiated desensitization. It was developed in Britain in the mid-60s, been used there ever since, and there's been probably several million injections given. And one of the advantages, it's totally safe. It's never had a fatal reaction ever since it's developed. And the reason is it's such low dose, so we changed the name somewhat in America with low-dose antigens because they're diluted way out. Our conventional antigens are diluted on a 1 to 5, and we take 1 cc of the next bottle and dilute it 1 to 5 again, out to about number 6. With this technique, we do it at 1 to 10, and we start at number 8 and go out to number 17. Now, in numbers, that's 1 over 10 quadrillion. It's so dilute it can't hurt you. Now, what makes it work, though...
Almost homeopathic, huh?
Almost.
Almost.
1 over 10 to the 20th power is homeopathic. This is out to number 17. So it's real. It's very dilute and can't hurt you. And you can put everything in there. There's 3 or 4 major advantages to this. One is it's totally safe. And 2, it has a 2-month interval on the injection. After 1 year, then you go to 3 or 4 months apart. Much more convenient than twice a week or weekly. And it ends up being less costly. Well, that's unbelievable in medicine that we should raise the price, but no, this is convenient and less expensive and totally safe. You can't beat those combinations.
10 to the 17th, just 3 shy of homeopathic, which everybody who listens to me would appreciate. That there's no harm to come to you from a homeopathic preparation, potentially a lot of help, but at that low of a dose, there is no problem with having any reaction at all. Yet, because they can stimulate the reaction you're looking for by using this enzyme, glucuronidase. Is it contained in the LDA preparation?
Yes,
okay.
That's the key factor to it.
Describe the the glucuronidase component, because that's what potentiates that 10 to the 17th to be able to do some pretty amazing things, but still not harm you. Talk to us about that for a bit.
It was discovered actually by accident in the Britain group. They were using this concept, and they 1 year they were treating people and it didn't work. And they started looking at this additional component they had to the antigens and found it was contaminated by beta-glucuronidase, and that was the thing that potentiated it. And the other factor in the enzyme wasn't even important, and so they got smart enough to just use the beta-glucuronidase, which potentiates the response to the extremely low-dose antigen. Now, there's a little problem with that. When you take the shot, everything in you becomes a potential allergen, and you may get worse from what's in you. So I hesitate to mention this to people, but the hard part about this is you have to be squeaky clean from your foods for 3 days. You can't be eating your usual foods, or you're going to make yourself more allergic. The same is true of the things you inhale. So in the diet, we teach people to eat only things that grow underground. They're tolerable, like carrots and potatoes and sweet potatoes and yams and rutabagas and some weird things that go in the ground are okay for the 3 days around the shot. So you clear your system by stopping eating your usual diet the day before the injection, the day of the injection, and then the day after the injection. You have to keep clean of your foods too. Then the next part's even a little more difficult. That is, what are you inhaling? Your diesel fumes and petroleum gases and perfumes and hairsprays. So the people with chemical sensitivity, we kind of have 3 levels here that people take, and that is easiest to explain to the patient that to keep safe when we give you the shot, you just stop breathing for 3 days. But people won't cooperate when we tell them that rule.
Okay, I got you on that one. Okay.
So we do tell them to be as careful as they can, you know. If they're allergic to gasoline, we had one that just got her shot last week on the way home. She's clear up from New York State. They stopped for gasoline. Now, these people should know that you drop grandma off down the block and you go get gas and you don't spill anything, and you come back and pick grandma up off the street corner. But they didn't. She was sitting in the car as we filled up, and she got a little whiff, and it may interfere with the treatment when people get exposed to those things.
That's interesting. So the diet component's a new thing for me. The 3 days, day of, preceding and post day, eating everything that's made underground. Anything gross underground evidently is the only thing that works in the food category. And then be very careful with not exposing yourself to any of the inhaled. And then you get this injection. By the way, when you say injection, it's still intradermal or sub-Q, or what is it?
Well, it's intradermal. Now, most people they've had a TB time test on their forearm.
Right.
That's where we do it, and we try to keep it right in the skin. Now, the usual testing dose is done the same way, and so the nurses in the office are skilled at doing that, to keeping it just in the surface of the skin, not subcutaneous like we give a shot, put it down into the fat. This requires being done. Now, the other interesting thing about this, when you give the shot, it may react a little bit. Sometimes it doesn't even react much. But the other interesting about this whole concept is you almost don't need to test people. Now, there's no need to go through all that sitting there and for 2 or 3 hours and having needles up and down your arm. Dr. Schrader, and by the way, the website we might mention, people get on it, is this www.drschrader, D-R, no period, SHRADER.com. People can go on the website and look on there. We have 68 diseases that we've treated in the research project we did back from about 96 to 01, I think it was. And we tested 10,300 people over several years. And again, we had 3 reported sort of side effects, nothing serious, out of 10,000 people. Over
3. There were 3. Unbelievable.
Yeah.
And they were minor to boot.
Right. And so, again, totally safe. And the interval, because this is treating your T suppressor cell, which goes around and tells the helper cells to calm down and quit being allergic to these specific things. Now, don't ask me how the immunologic mechanism of that. I'm not sure anybody knows. I'm sure I don't know the details of what happens in your body when you do this, but a lot of these things about this whole treatment were discovered simply by observing patients over that time period. I was doctor number 93 in a test group of about a little over 100 doctors that did this for several years, and we reported every injections and everything that happened. It was exquisite, detailed research to show how safe it was and how it worked and so on.
Well, you just mentioned something that that clicked with me, and I'm going to bring it to your attention when you say that the real mechanism by which this LDA approach takes is through the T system, the T, not the B system. And I'm listening to you prior when you were talking about immunoglobulins. That's clearly the B, completely different system. That's the B antibody response system as opposed to the T system. Did I hear you right?
That's correct. And the T cells manage your immune response. There's helpers that enhance your immune response and suppressors that push it down. These need to be balanced. They're both necessary because our whole immune system keeps us alive from bacteria and other various things that we need to be resistant to. And when you have an allergy, it's just something going wrong to something you don't need to be allergic to the foods, but you are. And this, fortunately, was found somewhat by accident with this mechanism, with the potentiating enzyme, balancing the T suppressor cell to run around and tell the helper cells to calm down about that specific reaction to your wheat, corn, whatever you have a problem with. And the other neat thing about this is that because there's such a low dose here, you can put everything in one injection. Now, when we did the research, we were testing formaldehyde and phenol and the chemicals and petroleum products and dust and molds and trees and pollens and foods and so on. We test them separately and then treat them somewhat separately. But Dr. Schrader, over the past 10 years or so, has perfected this down to a point where he puts everything in one shot. We even do our testing and give injections, and we usually end up with 2 serum bottles. That one is dust and molds, basically, and all different species of that, and the other one's all the pollens, trees, grass, and so on, and maybe cat fur and dog fur and so on. But with this system, initially we again separated those two concepts, but Dr. Schrader found putting them together it just saves time and effort and puts them all in one single injection.
And at the 10 to 17 level of dilution, just almost homeopathic, you don't have to worry about provoking any reactions from putting them all in one. So how many allergens, how many antigens are in an injection? How many different substances?
Just about 300.
301.
Yeah, that's mind-boggling. You don't have to test 300 things. The other thing about that is, what if you're not allergic to those things? Well, that doesn't matter. If you are allergic to them, it's got it covered. So there's no contraindication to treating everything you can think of. Now, it even has animal danders and even laboratory-type mice and rats that are in their laboratory and medical people. What happens to your career if you're a medical researcher working with animals and you get allergic to the animals? You have so many people in my practice that are virtually disabled from the various problems. I have one patient that's back on LDA. She was even on the research team back years ago. But she had to leave her office, so she works for the government, but is reactive to perfumes and hairsprays, and she works out of her home on a computer, and she hates it because she's a people person. She can't even go to the office. She reports in, and she gets paid by the work she does, and she does it from her home where she's squeaky clean. So she's able now to...
she's out and about now. She's back with people.
She's just had her second shot on the second time around now. Some people even feel they've been cured by this after about 3 years. Now, Dr. Schrader had been taking these since 91, I think, and he now takes an injection every 18 months, kind of whether he needs it or not. It's laying on the shelf. He might as well use one once in a while. But he's
even though he's symptom-free at this point, huh?
Yes, he's totally healthy with his allergies.
So the way you start this, so I'm getting this correct, you need not even worry about testing. Someone comes in and they can talk about the kind of symptoms they have. You can literally work off of their presentation and the fact that they have this symptom that no one else can seem to find out an explanation to it. And in the Roy Kerry world, that means, you know what, that could be due to an allergy. Is that a fair way to start?
Well, not quite, because people need to be convinced, particularly the variation here. If you just have pollens, and you know that seasonally, you've got itchy eyes and stuffy nose, and in the fall it's ragweed, then you'd want to treat it with ragweed, but you also probably react to the spring pollens a little bit, and maybe the cat fur, and you don't know that, and you probably react to foods too. So I will usually do maybe a bioset computer workup, or even just muscle test a dozen foods and show people, well, you're allergic to wheat and corn and eggs and cheese, and you don't know that. Well, why don't you just do a diet? Stop those foods for about a week and see how you feel. And people come back, they're amazed, they feel better. If they're not breathing their pollen right at that moment, see. And so it's a good idea, I think, to do a little bit of testing to convince the patient that it's worth doing this, you know. People are going to spend about $200 per injection, but that's every 2 months. Now, my patients spend $300 every 10 weeks to get the injections. So this is actually a little bit cheaper, and it's a lot less convenient. Now, we do have to give the injection in the office because we have to mix this enzyme and the antigen right on the spot and give the injection.
No, they don't come mixed. They're two different products. You have to put them together right there and then administer.
Yeah, it has to be within just a few minutes. You check the combination, and it works. We keep people for about a half hour, just watch their reaction. I'm not so sure what for, but you know, it's just customary in the allergy office when you give a shot, keep people around for a half hour, make sure they don't have any problem. But it's never happened with this. In Britain, I think they've given over 3 million injections, and it's the only thing allowed to be done out of a hospital setting over there. Other injections have to be given in a hospital setting so you can resuscitate you if you have to go down.
Yeah, and that's quite likely when it comes to the kind of injections given by the conventional medical community that are in a dilution that is much more potent than 10 to the 17th. 10 to the 17th resonates with me rather well. It's just almost homeopathic.
Right.
And then also, too, one should point out to the fact that in the testing world for the delayed, and let's just talk about that for a moment. You mentioned it earlier, And I was really startled to find out when talking to allergists, they seem to be very comfortable with and knowledgeable about the two kinds of responses. There's immediate responses, and then there are delayed hypersensitivity reactions. What I was shocked to learn from them was that they really feel that they only do treat the immediate. And if you have delayed hypersensitivity, you're not going to get any help from the conventional medical community and the allergy community because they just can't deal with that. They don't deal with that. That is extremely important for a listener to know, I think. Could you elaborate on that for a little bit?
Well, one of the common thing that people would know about is poison ivy. You get poison ivy and you get a rash about 2 days later. That's a delayed mechanism. That occurs with foods and so on. So if you're eating foods 3 times a week, you have delayed reaction 2 days, you're sick all week long.
And you have no idea what provoked it.
Right.
No idea at all.
It's hard to remember what you ate 2 or 3 days ago. And so you keep a diet diary, it can be done, but boy, it's tough. And so with the reflex muscle testing, I usually put people through maybe 6 or 8 of the common foods they're eating every day, and I say, ooh, you're allergic to 6 out of the 10 foods we're testing. You ought to stop that for about a week or more and see if you feel better. And they do, and then they come back and say, well, I need treatments for that. Okay, then those antigens would be the thing to do. It's simpler. It covers how many foods you want to test, cover 300, so just do it. Dr. Schrader has a neat way of answering our questions, so he said, send me an email, give me some space below your question, and I'll send it back by fax. I'll answer your question in the line between. So I sent him an email with about 6 questions. Do we have to test the separate things, and do we have to test foods? Do we have to test animal vendors? His answer was consistently, no, just treat the patient. You don't need to answer all those questions because it covers the whole waterfront and makes life simple, and you treat everything, and you can't miss anything. Now, he suggested not showing the people the food list because they'll find something from Tahiti that's not on the list and think it won't work. Well, foods cross-react to many fruits, cross-react with even pollens, and pollens cross-react to grains a bit, and so it covers the waterfront. You don't need to worry about what may not be in there because he's put the things all together. He spent the last 8 or 10 years putting this simpler and simpler to make life easy for us.
Now, and just as we're coming up, we've got about 5 minutes left here, and I think we're having a great first presentation today on LDL. And we're going to get very specifically about disease classifications because there's so many lists. I see the whole list at the website about what this thing actually could treat and has had success with. And the myriad, the list is huge. And today, we can't even get started in that, and I think that's a great issue to bring up on our next show, which will be next Monday.
I'm terrible at marketing myself, and at the meeting there last Thursday night, I didn't even mention my phone number and where I'm at with people in Butler, and I'm only 12 miles away, I think. But my phone number is 724-588-2600. If somebody on the line wants to get in on this, and maybe the next time we'll have more time for some good questions. If people want to get on the website of just Dr. Schrader, it's just SHRADER. There's no C in the name there. So the SCH is the valve on your tire. It's a Schrader valve, but it's SHRADER.com.
Okay, once again, if you're especially in the north, the number once again, right? So they can call you?
Yeah, 724-588-2600. Now that's my Greenville office where immensely I'm working from my Portersville office. Now the Portersville office is X96 on 79. I can get here in 35 minutes from the point. You get one light as you leave the point in Pittsburgh and turn left, and my office is the first building next to the exit 96 off of Route 79.
Is that before or after the Grove City Mall?
It's before the Grove City Mall.
Before
the two exits before the Grove City Mall.
All right,
so
there you go.
Come up shopping, stop by.
That's exactly right. And of course, I'm coming up in January to get my mentoring and my training on it. So for now, Dr. Roy is the only one around that does this stuff. So please avail yourselves if you want to get involved with it now. He could get you started, and later on you might even be able to transition to do it more locally if you are in the South Hills area. But for right now, Dr. Roy is the guy.
Yeah, when I took the training initially for the research project, I have the notebook, I have the tapes, and it was real fun listening to 20 hours of tapes. I'm going to loan those to you to bring you up to speed.
Oh, I will cherish them. I absolutely cherish them. But in general then, what happens is the person identifies themselves, you do some initial testing, sort of confirm and solidify in their own mind that they're not crazy, they're actually right, they do have specific allergies, but then you only test so few, but when it comes to what you're going to treat them with, 300 plus antigens, extremely low dose, 10 to the 17th, 3 powers shorter than a homeopathic preparation gets used. You give them an injection once every 2 months. Did I hear that right?
Yes, 2 months for about a year. And then you can start stretching them out. As the results last longer and longer, you can wait 3 months. Then about this into the second year, sometimes you can wait 4 months. You don't have any symptoms. And by the third year, many people just come back once in a while when they feel like they need it. So we don't use 4 letter words like cure, but it's getting close.
Yeah, and who had their life restored back to them by doing something even 3 to 4 times a year would raise a fuss. I mean, they would be so thankful to have their particular medical situation resolved from this that they would gladly seek the need to get the other shot. And to think that maybe within 3 years they can reach a point where it's just like almost a non-factor is amazing, I'm sure, to everyone who's listening to me today. And to think that this amazement can be enlightened by the fact that there's no real risk here, okay? There's no real risk, Roy. I mean, you're using such a diluted amount of the antigen. It is extremely, it's not just low dose, it's ultra low dose.
Yeah, and so I don't know that there's any downside to this method of therapy at all. And it's even less expensive than many of the usual things and a lot more convenient and totally safe. And I can't find any downside to the whole concept. On Monday we'll talk a little bit about some of the conditions.
Oh, yeah, there are many. And
debate people that I think food allergies cause almost all the gastrointestinal diseases. It's what's in your colon that's giving you colitis and ulcerative colitis and Crohn's disease and whatever doctors call it. They give these fancy names on them because some doctor described it back 100 years ago that didn't have any science, and it's almost all the things that happen in your guts due to the food and whatever you're putting in there, and maybe parasites and antigens to fungi or whatever else is in there, but we got them all covered. It has all the kinds of molds, and we even cover a few of the bacteria that get in the gastrointestinal tract to treat other diseases like arthritis. I'm doing a little baiting on the people to make sure they come and listen next week.
Oh, yeah, I think you have, and I believe you put it in the right category. You know, when people are thinking of allergies, they're thinking of the seasonal stuff, you know that?
Right.
That's what they identify with most, when in fact, this thing really is talking about the diseases that you wouldn't think were due to allergy because they're delayed, they're not immediate. You know, you're a pretty intelligent patient out there. When you eat something that causes a problem, you know it. You don't need to be tested. But these delayed things cause a lot of confusion because there's no rhyme or reason for why you're having a symptom 2 or 3 days later. You don't remember what you ate, as you already described, and so delayed hypersensitivity reactions are usually the key. And I think you said that the gem, Roy, which was you believe, as I'm learning to believe, anything gastrointestinal would have a strong possibility to be allergy-related. Fair enough?
Yes, well, you can get appendicitis. That's not an allergy. You need it out. But
yeah, they need that out.
All these other diseases that we put these big names on and describe them and name them after some famous doctor that lived 150 years ago, they didn't have the science we have today to figure these things out. And doctors still just call it the name and put you on drugs and give you steroids and so on to suppress the immune response. Same is true of asthma. These are all allergic mechanisms, and they have all these nice drugs. And they do work, but they're expensive and they don't solve the problem.
Yeah, I think maybe that's another good thing. If you improve from whatever you have by taking steroids which suppress the immune system then your problem lies in the immune system. How about that, Roy?
Yep, that's a true statement.
How about that one?
You're just suppressing it and pushing it back a little bit with your asthma, your gastrointestinal diseases, and your rashes, and your eczema. All of these are immune imbalances that this will fix.
Perfect. Hey, we do, with a minute or so, we'll get a quick caller. You don't mind taking a question, do you,
No,
Roy?
let's do it. And
Come on
time.
ahead. Yes, absolutely. Well, more for next week, too. You're ready? Go right ahead. You're with Dr. Roy, please.
Good morning, Dr. Courtney, Dr. Kerry.
Yes.
I got a cousin. She's a farmer, so she's dealing with industrial products plus a lot of natural products. How would you do blood testing for her allergies?
That is the type of thing that we can skin test, but it's somewhat pointless. If people know that they get in marked difficulty with their exposure to the workplace, and they are well on the weekend, and sometimes it takes longer than that to clear, then we would treat the chemicals. Now, there's sort of 3 stages of this. The simplest is just the things you breathe, and second adds the foods, and then the third goes into a separate injection for all the chemicals. That includes everything except pesticides and herbicides. We won't put poisons in people, but everything else in terms of petroleum, formaldehyde, and cigarette smoke, and all those things that bother you, and the industrial chemicals, all the solvents, and toluene, benzene, etc., they're all in there.
They're all in that 300 antigen stuff. Oh, they're all there already, correct?
Right. Now, this is a separate injection for the chemicals. There's just 2 or 3 choices in terms of the shots. Some people may end up with a third one, but in my office, that's the same price. It just takes another minute or 2 to do the third thing. But you have to prepare yourself a little more stringently if you have these chemicals.
Okay.
Like that rule, you don't let it breathe for 3 days.
And right, and you have Grandma be dropped off before you load up with the gas tank. So,
right. Mm-hmm.
So that's it. Well, there you go. Good question there, right at the gong. And there's bongos. Hey, we got a crescendo moment here, sort of like the Lawrence Welk show. Look, you are going to be back on Monday. We're going to be talking about all those diseases that maybe you should be thinking about and you're not thinking about right now, listeners. So you want to pay attention with us on Monday when we return with part 2 with Dr. Roy Kerry on LDA. Now you know what it means. Let's see if it's going to be helpful for you. And more about it on Monday. Thank you, Dr. Roy.
Yeah, people maybe get on their website and have it in front of them when we talk about this on Monday.
Very good. See you then.
Thank you.
Okay. There you have it, folks. For now, this is Dr. Dennis Courtney with Dr. Roy Kerry saying so long for AM Impact on Your Health.
AM Impact on Your Health is sponsored by Dennis J. Courtney, MD, Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002.